Thank you for inviting us to share our needs-led research approach for health science PhD studies at OsloMet University in Norway. My name is Sally Crowe, and I'll be presenting on behalf of the team who are listed below in this slide. Needs-led research from our perspective is about making PhD studies that will be more interconnected with clinical, educational and community settings, and also crucially reflect current evidence. And the aim of this initiative was to connect healthcare research and healthcare practice by building bridges between three distinct settings and communities. The first was between academic settings and healthcare and community settings. The second is between people that produce research evidence and those that use it or maybe not. And finally, between those that provide health services and those that use health services. So we call this our Bridge Builder project. It has three underpinning concepts. The first is evidence-based practice, where practitioners combine up-to-date evidence as well as professional and service user experiences and preferences to shape care and treatment. The second, which you'll be very familiar with, is evidence-based research. And in this context, it is where our PhD students acknowledge and build on existing evidence base and identify evidence gaps. And finally, our third concept is stakeholder involvement. And here we mean healthcare practitioners and especially the public and users of health services who have a say about the direction of the future PhD research so that it reflects identified and important stakeholder needs. This is the main part of our poster presentation, and it concerns the progress we've made so far. So to remind you, the context for this initiative is a 5-year health sciences PhD program with 8 candidates from a range of health and social care settings, as you can see. 60% of the time they do their academic studies, and the 40% of the time they combine clinical or community roles, specifically teaching and supervising colleagues and staff and students in implementing evidence-based practice. All of our students have had to learn and deploy new skills in stakeholder involvement or build on those they already had. And this is around working in different ways with different groups of people using different methods, and we've listed some here. It's also been incredibly important for them to build relationships and networks, both for the initial phase of their PhD, needs-led research, which I'll come on to in a minute, but also as the PhD research gets underway. And as we all know, in 2020, COVID has got in the way of this important work. And we must congratulate the students on managing to take all of their stakeholder involvement online and continue to do this work during the pandemic. In terms of needs-led research, the progress is complete. The initial 9 to 12 months of the PhD program was spent identifying, prioritizing, and building their PhD research question or questions with their stakeholders. Some students have departed significantly from the original scope of their PhD studies. Others have had similar questions prioritized to their starting ideas. And it's been important as a cohort of students, but also as a team, to reflect on these changes and how students and supervisors feel about them. The fourth element of progress has been evidence-based research. And again, this is complete in the PhD program. All the students have planned and completed reviews of existing evidence, focusing specifically on systematic reviews, noting where there was low quality evidence and gaps in relation to the scope of their PhD research. And finally, they are now in the stage of doing their PhD research. And we've listed here some examples of questions and areas for exploration in their studies. And you can see how diverse they are. 2 of our students have published academic papers of their needs-led research process and outcomes, and we've listed the links there for those people that want to follow up. There is also a paper in Press about the whole model, which we have described and rationalised, and we're just waiting for peer review of that. And then finally, the whole team are learning from this experience, and we aim to publish results of the whole PhD programme in due course. Many thanks for your attention, and we look forward to hearing your questions.